We begin by acknowledging the traditional custodians of the many lands on which we record, learn and practice, and pay our respects to elders past, present and emerging. Welcome to Dental Yap, the podcast from Collective Dental Education, where we get into the conversations that matter for dental and oral health professionals. I'm Lucia, and joining me is my friend, colleague and co-founder, Janet. We're both registered oral health therapists, and somewhere between teaching, the clinic and a lot of good conversations, this podcast was born. Because the mouth doesn't exist in isolation, and neither do we. Each episode, we connect with clinicians, researchers, educators and changemakers from across dentistry and the broader world of holistic health. People who understand that what happens in the mouth is connected to everything else, the gut, the body, the mind, and the whole person sitting in the chair. We talk to people who've faced real adversity, who've navigated burnout, broken systems, and moments of doubt, and come out the other side doing something remarkable. People who are quietly, and not so quietly, shaping the future of dental and oral healthcare in Australia. These are the stories that don't make it to the textbooks, the insights that shift the way you think, and the conversations that remind you and us why we chose this profession in the first place. So pull up a seat and let's have a chat.
Hello everyone, welcome to our second Collective Dental Education podcast, and we're very excited today to be chatting to Doctors Adam and Nikki Barrett, who have a wonderful practice on the New South Wales Central Coast. So personally, I have a very long relationship with these people, so fantastic dentists. We're really excited to chat to them. So welcome, Adam and Nikki, to our podcast
Thank you very
this
much.
morning.
Thank you.
Yeah, we're excited to chat. And we thought we'd just throw a couple of questions at you to get things started. And of course, welcome,
Hi.
Lou. Good morning to Lou this morning too, my business partner there. So guys, tell us about your career stories. I don't mind who goes first or if you do it together, but what's your story?
So I have an undergraduate in nutrition and dietetics, and in my fourth year of nutrition, my head of school came to me because I'd been doing a few projects on child dental caries, and she brought to my attention that Charles Sturt University was about to undertake a new undergraduate program for dental students. So she actually put forward my name as a recommendation, and from there I managed to get into the program, which was great and changed my life and changed my career. So my trajectory was a little bit different. So I started in an orthodontic practice and then worked for the Aboriginal Medical Service for a little while before moving into private practice up here. And then I have also worked at Wyong Hospital in the public system and also as a university lecturer at both University of Newcastle and University of Sydney.
Wow, lots of different experiences there, Nikki, that I'm sure have all added to your ability to successfully run a private practice with your husband, who tell us your story,
started early in
Adam.
dentistry. I started scrubbing instruments as my first job with someone who is here currently at a private practice in Gosford. And so I'd come school holidays after school, learn the ropes, finally graduated up to chairside dental assisting, still at school. Thought I was going to be a professional football player, playing for the Sydney Roosters. And then that got squashed very quickly with a bit of an injury. And then I wasn't concentrating too much on school. So I then went into dental therapy, enjoyed that very much, came back, worked at Wyong, where I met up again with you, Janet, and then went off to do oral hygiene at Melbourne Uni. And then from there worked in private practice as an oral health therapist, also at an orthodontic practice as well. I could see myself feeling a little frustrated with certain sides of dentistry. And it was just when dental therapy was allowed to work privately, going from the public sector only. And I could just see limitations and I wanted to improve, get more, get better, do more. So I went to Charles Sturt Open, very similar, as a option. And we got in from there. And then from there, we've gone to Sydney University to do postgraduate in dental implants and postgraduate in orthodontics. And then, now we've got our practice, and it's grown from a 2 surgery practice to a soon to be 6 surgery practice. And very much community-based, very much family-based, very family-orientated. We like to give back to the community as well. So it's something that we're really proud of, something that we can say to our patients that we walk down the street, say hello, catch up with them, not just, dodge them on the sidewalks. So, yeah, it's really good.
Yeah, you guys have got so much experience and so much history in so many areas, and I know that all that experience and all those experiences has just added so much to the way you manage your practice and your team, because I know you guys well, and I know your team as well, and you just work so smoothly with them, and your staff are really happy. How do you achieve that? Because you keep long-term staff, and your staff speaks so highly of you, and you come into the practice and you can really feel that
Starting
happiness.
from
How do
where
you
I
guys do
started,
that?
there's no hierarchy. So we don't, as a dentist, we're the same as someone who walks in and who's a trainee dental assistant. I think that if you have that relationship with your staff members and not looking down to them, happy to get in scrub instruments if you need to, do whatever to help the team. I think it's really important to make sure teamwork is the best way. But we also do outside work as well. We were doing Pilates there every week as a group. We'd sort of close the practice for an hour and a half, take our employees down, do a Pilates session, and then come back. Or we're constantly trying to get out and do something different. We did a Indigenous art session. We've done pottery making. So we really try and put back as well, or give back. And I think when everyone's happy, the team works well. And when the team works well, the practice works well.
I love hearing that, because, that's my belief too. If you're at the top, you're no good unless your team is wonderful, and being able to manage like that and put in all those extra things is so valuable. Do you want to say anything about the Indigenous aspect of your
I've got
practice,
Indigenous
Adam?
heritage, and we've got quite a few of our team members with Indigenous heritage, which is an interesting side of it, where a lot of us come together and we can have a little bit of a chat about it, which is really good. But I think we did a really nice artwork for the practice, which has a little bit of a story about it, but it also importantly has all of our handprints on it. And I think that makes, for one, a really nice artwork, but two, to show how we all work together as well.
That's really lovely. That's lovely. And Nikki, I'm going to throw to you now, because we know that you've taught at Newcastle Uni and you're currently teaching at Sydney Uni. What is it that you
I
love
fell in love
about
with
teaching?
like as soon as I walked into the clinics in Newcastle. I remember being very green as a tutor and just watching the students go from not really knowing even how to communicate with a patient to start to gain confidence as they go on and talk to the patients with more authority and more confidence than what they would have at the beginning of a semester, and just watching their hand skills develop and their relationships even with one another develop as like assisting and communicating in a team environment. And I don't know, I just really love being able to sort of pass on the information that I've learned as a clinician to my students as well. So letting them know not just, all of the information that they need to, but also giving them like a little bit of an insight into clinical practice as well. Like, I've had failures in the past and I've shared that with my students, and just helping them know that we're humans, we make mistakes, but it's how we handle like fixing them. And I think the students really like to relate to a practicing clinician, because then that gives them a real life sort of look at what they're going to be facing in the future.
Yeah, I totally agree. And I know Lucia agrees too, like having teachers in universities who are practicing clinicians is so valuable to the students. It really is. Lou, did you want to
Yes,
make any
well,
comment to that?
actually, I would like to go back to Adam for a second. I'm just wondering, Adam, how old are you?
Sure.
Because you don't look very old, and I feel like you've accomplished from scrubbing instruments after school, and now you're a business owner and you work alongside your dentist wife, and like, that's amazing. Like, really?
I think the anti-aging effect is because Nikki's so good. She looks after everything, does everything. I just rock up and try and make things look better. But No, I think I'm ambitious. So a story that maybe not a lot of people know is I bought this practice off a retiring dentist when I was in my second year of uni. He was retiring, he was leaving with no successor. So I had a little chat to him and yeah, we went from there. We closed the practice for 6 months, did a full renovation, got it up to code, got it up to scratch, and then employed a couple of people that I'd worked with in the past and got a dentist on board, and yeah, then it just sort of flowed from there. So it was a lot of hard work, and I was maybe taking phone calls inside outside of university, booking patients in, making it work. But yeah, we made it work, and I think if you have that ambition, yeah, you can go a long way.
That's amazing. And do you think that
Yeah.
you
Yeah.
and with your background and Nikki with your background, especially with teaching at the university, is why your team is so successful because you're in that role, you understand, you've been in that role, you understand OHTs and hygienists as well. And I guess you're not afraid to, as you said, there's no hierarchy. You just understand these roles so well because you've been in them yourself. I imagine that plays a huge part in the success of your workplace team.
I think that, like our current oral health therapist, I actually taught at Newcastle University. So I think just knowing that she has that support there, that you can come and ask questions. We're not going to ever say no to a question that's being asked. We always make that time. Even though we're quite busy, like we'll say, oh, we'll be in like 5 minutes or so. And we just take that time to go through things that the therapist or hygienist might be unsure of. I think we're pretty fortunate in the fact that our communication skills are pretty good amongst the team. So no one's sort of afraid to approach one another, and we'll ask each other questions and challenge each other with opposing thoughts sometimes. But it's
All healthy discussion. That's all
right.
good to
Healthy
have.
discussion. Yeah, absolutely. And I mean, if you're happy to take on board the other person's point of view, you often learn a few things too. So
Absolutely.
I
Yeah.
think that helps.
Yeah, I think having that open communication is so important because I'm many years older than all of you. And when I graduated, it was very much, you're told what to do and you do it really. The landscape has changed considerably, and private practice rights and adult scope of practice have all changed that landscape for dental hygienists, dental therapists, and oral health therapists. What are your thoughts on that development for those professions and how that scope is
I
usable
think
or
it's
impacts
it's
in your
definitely something
practice?
that works well if the team is on board with it. I think you've got to educate not only the principal dentist, but also the associate dentists on what can and can't happen or what we can and can't do as oral health therapists with adult scope. Also, too, I think a big thing is university training is great, but we do need to continue with the CPD. I think if you don't continue, update, grow, learn, it's not going to be a successful outcome. I don't think we get enough clinical training with adult scope to come out and then be straight into drilling, filling on adult teeth. I think that it's definitely a fantastic initiative, but I think having a very supportive boss, having someone who will encourage CPD and time off for CPD as well, that's where I think oral health therapists need to do when they first come out. Another thing I would always recommend is with that adult scope is just maybe taking photos. Take photos of your prep, taking photos after, and then set aside some time with the principal dentist or an associate dentist and just go over it and really hone skills that way. Definitely every oral health therapist we've had has definitely had the talent, but I think confidence is lacking and experience was lacking a little. So I think the training's there. They just need a little bit more tweaking, a little bit more practice, but definitely a valuable asset to the team. And just as long as I come back to everyone's, as long as they understand the limitations of scope.
Yeah, I totally agree with you, Adam, and we all know that when you come out of uni now, that the amount of clinical work that most students or most graduates have experienced is quite reduced to what many of us experienced. And also, I really liked what you said about the adult scope. taking the photos, discussing it, and talking to the dentist and the practice about, how far you can go, because providing restorative work on children to 18, as we all know, is so different to providing restorative work on someone who's in their 40s or 50s, who's got a couple of teeth missing and maybe a bridge, maybe some implants, TMJ issues, all those complexities that young people often don't have, do
I
they?
think occlusion.
It's a very different
we don't
environment.
get taught enough about occlusion, especially in that adult scope side of things. I think occlusion is where restorations will fail very quickly if we're not aware of how that deep bite or missing teeth or angulation change and how that impacts on that restorative side. So, and also to material science, I think we need to make sure that we're all over the material science side of things, like the different bonding systems, making sure we know when we do go into a practice that we know what type of bonding system they use, what type of bonding system you use, and have the confidence to ask for what bonding system you're comfortable with, but also to have the confidence if the principal dentist says to you, look, this is why we use it. How about you try that and give it a go?
Yeah, that's all really good advice. Nikki, do you have the same sort
Yeah,
of
I mean,
outlook about
I
that
see
and
it from
scope?
both sides, particularly now. Like I see them before they graduate, and I see them still learning a lot, even towards the end of, last semester. And sometimes we don't meet requirements as students. So I really do encourage, if I was to give any new graduate advice, it would be to find a supportive and, someone who's willing to help guide them in their when they're looking for an employer, because I do think that is just so important, particularly as universities take more and more students and we're looking for more and more chairs to give them that experience. And unfortunately, sometimes they're not there, so their time does get cut. And I think that's probably something that, institutions need to look at as well, to make sure that our graduates are still getting that experience, and particularly with those adult scope restorations, because a lot of students aren't picking up a drill until late in their second year or early in their third year. So yeah, I would definitely recommend extra practice, extra CPD, and having the confidence as well to let your boss know that this is the first time I'm attempting this. Can you sit with me? And I know that we would happily sit and assist to make sure that we were supporting our new grad oral health therapists.
Yeah. Yeah. Oh, that's a really good point, Nikki, because I know from my teaching experience, even in sim, having students work in pairs, so one's drilling, one's doing the suction, and then they swap over, they learn so much. And same in the clinic. And as you said, if you come to work for someone and you haven't done many of that procedure, then get your dentist or your senior oral health therapist to sit with you and watch and give you some instruction. I mean, that's so valuable, isn't it, to be able to do that, to be able to actually watch and then, or have someone sitting with you saying, yep, that's great, maybe take a bit more off on there or whatever. And I'm not sure that there's a lot of that goes on, because practices are busy and some of the corporate practices have got KPIs they've got to meet for patients. But I think it's how it should be now, because we've got graduates that are coming out that
and
are
I mean,
a
if you
little
think
bit
about
green.
it, like the time that you're going to spend replacing those fillings that are going to fail anyway, it's worthwhile just making sure that we're getting that training in the first place, and making sure that your oral health therapists are gaining those skills and gaining that confidence.
Absolutely. It sounds like
Yeah.
your oral health
Look.
therapists are in a really supportive workplace. Like, I think for students that I have that are about to graduate, that's probably one of my biggest things that I try and encourage them to chat to their principal dentist or the owner to say and negotiate either CPD within their contract, and also mentoring. So, and mentoring could be assisting the dentist when they're doing a complex filling, but being able to have the opportunity to ask questions throughout the procedure. That's so important and so valuable. But I just don't know if a lot of dentists are there and understand that OHTs absolutely need that support when they first enter the workforce. So it sounds like your OHTs are very fortunate to have you both, because I just feel like you're a bit of a unicorn. They're not all dentists are this supportive?
I think I'd look at,
Mm.
exactly like that. But as a patient, if you've got a clinician helping another clinician, that patient's only going to see that as a positive. Even if, say,
Yeah.
if the dentist is the one doing the work and the oral health therapist is assisting for the first time, or it might be the other way around, I think we should only see it as a positive. And I really believe that we should never quota anything. We should always make sure that the patient is the main focus, not on, any of the corporatization or anything of dentistry. I think we just need to make sure we really focus on that patient, and then practice success comes from that.
Yeah, I think KPIs are a
Yeah,
dangerous
yeah,
aren't they?
absolutely.
First and
Yeah.
foremost, we're health professionals. We're not business people. I think that's where sometimes that gets lost a little bit.
Definitely. And I think for new graduates as well, and it's unfortunate that we live in this very tough economic times. The cost of living is so high. And a lot of new graduates, they're chasing money. They're going straight out into a job that pays the most, and they're seeing more dollar signs first, which they have to, unfortunately, but they'll sacrifice their mentorship support systems. And unfortunately, they're not going to grow as a clinician.
Even on that, I think we've had that interview process. And I think that if you are, from a business point of view, if someone is after the money, then it's probably not the best thing to do. I think really hone your skills, show your worth to the principal dentist, then go from there. Then
Yeah.
renegotiate after 6, 12, 18 months.
Yeah.
Because I can say safely that if your principal dentist sees you come in maybe a little bit under market value, and you're working hard, doing really good restorative work, they're going to come to you and say, here's a pay rise, you're doing amazing. They're not going
Yeah.
to come to you and say, keep
Mhm.
working harder. But
Yeah.
if you do ask for $100 an hour, they're going to expect you producing a lot of money coming out of your surgery. And then that is just an extra stress you really don't need in your first 12, 18 months of practice.
Yeah.
Yeah, that I really like that point, because I think it's so important that in our new grads and our young practitioners that we try and impress upon them that we are healthcare professionals, as you said, Nikki, and there's a great deal of honour in being able to provide that for the public, and they come to us expecting to be looked after, and that should always be the focus. Of course, the financial side is extremely important, because otherwise you can't keep a practice going. But I think having clinicians who genuinely care about their patients and genuinely get rewarded by seeing a great restoration or a great crown, or, restoring someone's smile or fixing someone's severe TMJ problem, that's just such a
I
wonderful
know that
feeling
when
for us,
Nikki
isn't it?
is at work with us, I'll often say if she can come and check something for me, as if that it's a problem. But it's always normally a nice restoration.
Yeah,
You've got to show off your work somehow, Adam.
Yeah, patients go,
You
oh yeah, that's a
do, you
tooth, well
do.
done.
And
But we can appreciate it a little bit.
yeah. And I think the patients feel a lot more than maybe we sometimes think, because they come back, don't they? And they don't just come back themselves, then they bring their mothers, their fathers, and their children, and that word of mouth. I know you have a huge word of mouth patient base. And I also know you do a lot of community stuff too. Do you want to tell us a little bit about that? I know on your Instagram, we see some footballers and some AFLers coming in to see you too. So, and I know that that's a bit of a love of yours anyway, Adam, with football. But tell us about some of that community stuff as well
I
that's
think
connected to your practice.
the football side of things is a hobby, I guess. Like I said at the start, maybe a frustrated non-football player wanting to still remain connected. We sponsor a couple of players down in Melbourne. That's who I follow. And we get to go down there, and it's really nice. Get to take the family down as well. So it gives them a little connection. We've got a couple of players that play State of Origin, Australia, and it's really nice even just to say, oh, that smile, a face of that smile that we've done that, and the kids love it. I think that's where I get the biggest joy out of it. Or another player who's playing State of Origin tomorrow night, my son just thinks he's the world's greatest human. And I showed a photo of me standing next to him at work, and then he thought I was the world's second best human. So it was really good. But far as community side of things, we really do try and keep it in the family, like in around the people that we work with and for. We definitely do a little bit of unpaid work for patients who really can't afford it, and we're definitely looking at doing a little bit more with that. We had just an example the other day where, like I lost one of my mates to brain cancer, and another friend as well to brain cancer, and they were doing a little bit of beanies for brain cancer fundraising. So we got to sell quite a few beanies for them, which was a really nice thing to do. But definitely just try and get around the local communities and help out that way. But a little bit different. We like to try and help the people who come to us as well, more so than reaching out and doing other things. Like, we really like to help support the people that come into us as well.
Yeah. And I totally can say that I've seen that many, many times from both of you. So thank you for what you do for your patients and your community. You've both got really big hearts. Lou,
I do. So
you got a
as
couple of
a
questions
husband and
too.
wife dentist team owning a practice together, working together, do you split shifts so you don't sort of see each other every single day? How do you make this work? I'm interested to know.
So when I first started working up here, I worked at another practice just so that wouldn't happen. So I worked at a practice in Terrigal for a while, and then when I came back from maternity leave, Adam was like, "This is silly, just come and work for us. We need another dentist." So funny you should say that, because we actually never see each other. We're so busy that we might get a 10-minute cup of coffee together if we're lucky.
Yeah.
Otherwise, it's usually part of the consultation process. If I need assistance with an ortho issue, or Adam's called me in about a jaw problem, it's usually just what a normal team would look like anyway.
I think we've done it strategically too. In fact, we've done it the opposite. So we've taken a Wednesday off, so we have it Wednesday off together, and that meant that we could work on a Friday together as well. But how we've done it is not stepping on toes. Nikki's got her side and her avenues of where she likes to work, and I'm almost directly opposite just by nature. So I like to make things look pretty, and Nikki likes the blood and guts. So it works really, really well, where she can do her side, I can do my side, and then we can work well as a team as well. So I think I could definitely see problems just talking to other people where you're both doing the same sort of thing. But for us, we do such different stuff. And like Nikki said, I think we see more of each other when we're not working together than when we do. So, yeah. Well, I enjoy it.
Yeah.
Maybe Nick does. I don't know.
I do enjoy it.
Good. And you've got other dentists too, haven't you, working in your practice, as well as the two of you NLPs and hygienists? You've also got other dentists.
At the moment, we've got 4 other dentists and 2 oral health therapists. One of our dentists, amazingly, has just come back from maternity leave today. Is her first day back. So, yeah, I know she wanted to come back after 3 months with her first baby. I said, no way known. 6 months at best, and call me when you want extra. But it's her first day back. So there's a tearful hug when she first came in. I said, this will be your hardest day. But yeah, we're so stoked to have her back. So we've got a couple of new dentists that have started, and one's a new grad, and he's really picking up its skills and honing skills. And then got a rock star who's come in, and she's just killing it. She's amazing. So got those are the dentists. And then, 2 oral health therapists. One is hygiene only, and other oral health therapist is adult scope trained. We encourage to have your own little niche. So Nikki's obviously diet TMD, but even the oral health therapist. So our oral health therapist really enjoys orthodontics, and the other hygienist enjoys a bit of perio, but a little bit of orthodontics as well. So it works really well, making sure that you have your own little niche, because I think then you enjoy your treatment and your work days a lot more as well.
100%. And it kind of feels like you have a little bit of ownership over that. Like it's your jam, it's your thing, and people can come to you for advice. And there's a lot to be said for longevity in practice when you have something like that and your boss or the person who's paying your wage respects that. And it sounds like you've got it in spades there. And going back to your dentist, do you believe that dentists are also coming out with not as much experience as maybe once upon a time they were? Do you think that they still require a lot of mentorship, the same as OHTs? Because I feel like the cohorts are quite large when they do graduate, and there's just not enough time for them on placement to gain all of their skills they come out as competent, but definitely not confident.
Yeah, I think definitely. I think our training, like when I went through dental therapy training, we were drilling from probably week 2. And we were 5 days a week, 8 till 5 o'clock, and you were seeing patients constantly. Same with dental hygiene. And then even in dentistry, when we're at CSU, we were seeing patients from year 2 and year 1, the clinic was still being finished and built. But then years 4 and 5, or all of year 5, we were seeing patients. So we came out, I felt relatively clinically competent, but I think now there's such a big push from the monetary side maybe that doesn't happen as much. And I think the experience of students coming out, we can definitely see a bit of a decline in the experience. But I really think it's across the board. It's definitely not just oral health therapy. It's definitely dentistry as well. And like I said before too, I'd really strongly recommend getting around some really good CPD and finding people who you relate to and relate with. And I know that I've found a group who are just amazing at restorative, and those guys I look up to immensely. So you've got to make sure you click with the people that you're listening to as well, but definitely get a wide range of CPD.
You're probably you're talking to people who graduated with their cohort. Like we only had 34 in our graduating year, and you see these cohorts of over 100 coming out these days. And of course, there's not going to be as much time to have that one-on-one time with all of your clinical mentors because the cohorts are just so much bigger. But that's not to say that they're not able to do these things. It's just getting the support that they need when they first come out from good employers and a good team network too. An experienced dental nurse, dental assistant goes a long way too. I remember when I first graduated, my first dental assistant was actually an overseas trained oral surgeon. And what I learned from her when I was doing extractions at the Aboriginal Medical Service was probably more than what I'd learned doing extractions at university for the last 2 or 3 years. So that can sometimes be really helpful as well.
That's another good point, Nikki. They're part of the team too, aren't they? Dental assistants, and none of us could work without them. And having one that's really experienced is so valuable. And having sat on that dental assistant side too, like Adam, before I did all my other stuff, really having a dental assistant that can read you and that you can work solidly as a team and know each other's moves is just great. And you can only get that if you've got a great practice and a great team, because then they stay with you for a long time. And then just to be fair, let's not forget our receptionists, because, without someone booking the appointments and welcoming the people when they come in, we haven't got a business. So you guys do all of that so well. Your dental assistants are great. Your receptionists are lovely. I think you should do a course for dental practices and give them some insight. In your spare time. Yeah. For our listeners, I hope you won't mind, but Nikki and Adam also have 4 children. So that's an achievement in itself. So apart from their practice and their study and their teaching, they've also got 4 little ones, which is, of course, a wonderful achievement.
Can you tell us a little bit about any major challenges that you both have experienced in business where you've had to really pivot and do something completely different? Has anything like that happened to you since working together?
Post-COVID?
Yeah, COVID was really challenging. I think mentally, I just remember driving out when we had to close a practice for the first time and just not knowing, like working so hard to try and create something and then not knowing what we were going to ever walk back to. I still remember that drive home, the phone call to Nikki on the way home. That was the craziest drive home ever. But I think how we've sort of set up work is, there hasn't really been any differences, I don't think, other than COVID. But
I mean, I think we've pivoted more to our interests more than anything. So Adam's obviously loves orthodontic work and has gone into implants as well. So it's really been like personal challenges, what we've set for ourselves. And then I've gone into a little bit more of the teaching side of it. So I've completed my grad cert in tertiary education. So it's been more what we've sort of pushed each other to do and pushed ourselves to do.
I think actually probably if we got that question in 6 months' time, we'll definitely have a lot better answer. We're going to the States in a couple of weeks to learn about cranial nerve function and the relationship with occlusion and that neural feedback to how the body works.
That would be so interesting.
Wow.
Yeah.
Wow.
It really blows your mind, all these links, and then you see it in practice and you see America's a lot more ahead of us in this area, but you see that and you're like, wow, there's something definitely into it. It'll be Nikki's first time over to have a look at it and just seeing, even just the shape of the roof of the mouth and how that interacts with the feedback. So maybe like some donning on one side of the roof of the mouth and then on an older, like an adult patient, and then they've constantly had lower leg issues on the opposite side. It's just, you fix that and it potentially can fix that neural pain that they've been experiencing for the last 5 years. It's really exciting part. I think we're both very much evidence research based. We really want to see that side of it, not the smoke and mirrors that can sometimes happen. So we're definitely looking into it. And also maybe 6 months time, there's going to be some really interesting stuff coming out of Seascape Dental with that area. But we're putting in a exercise gym area upstairs at our practice for this practice. So for looking at that neural cranial nerve function. So it'll be very interesting.
Yeah.
Yeah, that I think we'll have to have you back for a webinar once you've both
absolutely.
done that to give us some info. But I do know someone whose name I won't reveal who had some treatment from you, Nikki, for a really serious TMJ problem that had gone on for years, a bilateral mesenteric hypertrophy. And that patient, you changed their face, but you also changed their life because that patient was in constant pain, not just their jaw, but their neck and their shoulders as well. And their face was a completely different shape before you managed that TMJ problem for you. So I've seen that myself, and I know in Lou's practice they get a lot of patients with TMJ issues, and that it can be chronically destroying, can't it, for their teeth and their life.
I think that's
pain.
why we've had this interest sparked in us, because the relationship with obviously occlusion with orthodontic treatment and TMD, like I suppose that's why our areas work quite well together. But that's definitely something that I'm passionate about. I really dislike seeing patients in pain, so anything that we can do, we try. And sometimes it's beyond scope, and that's when Lucia probably gets a few of my referrals to her practice when it's like joint related that I am not qualified to do surgery on. But a lot of the things that we're managing now, especially with like red light laser therapy, that's really exciting. A lot of our patients are getting almost immediate relief from that, and so just supporting them with things like that is really exciting as well. So the newer technology that's coming in is really good as well.
It's super interesting. Nikki, have you heard of, I'm going to get this wrong, for pelvic floor, it's like the chair that you sit on, and it's called the...
I know the one you're talking about.
Yes. So that company has something for TMD relief as well.
Okay. Yep.
It's supposed to be to tighten and firm muscles. Like I think it's promoted more for anti-aging. But since they've been using it, people have noticed a really big reduction in TMD pain.
Yeah, amazing.
I'll send you the details.
Thank you. Yeah, right.
Because as you said, like the new technologies coming out are really have a lot of research-backed information for patients. There's a lot more room for patients in decision-making of how their treatment is. It doesn't have to go straight to surgery now.
That's
There's
right.
a lot, there's a lot more
To be
scope
treated
for.
quite conservatively.
Absolutely, yes. You'd go the conservative route first. So there's a lot more options now, which is really exciting.
Yeah.
And there's even a dentist who's started to do like sleep studies. So you can do take-home sleep studies that are probably the same cost as, your Medicare rebate.
Yeah.
Only covers a certain
Fantastic.
amount. So that's making that a little bit more accessible to our patients that have sleep apnea as well. So,
But with that, what you were saying before too, Lisa, there's in this course, and we'll be out in America, the pelvic floor, the jaw, but also the diaphragm as well. That's where it's all linked. And it's interesting that the company has gone from 1 to 2, but maybe the third one, and that's what we'll be really honing in on, and how it all interacts with the body. Yeah, it's interesting that one, like that they've designed something for the jaw. So
maybe they know something.
Yeah. Maybe it's not smoke and mirrors. Okay, we're onto it.
Maybe there's something to it. It is very interesting. Yeah, absolutely.
And isn't it good that finally, after hundreds of years, we're now trying to work so much more holistically, not just having someone coming in, drilling in their tooth or taking a tooth out. We are spreading our wings. And we know from so much research that oral health is so connected to so many different medical conditions. It's great to be able to expand like this and get all this extra knowledge. We've recently had an orthodontist and a sleep specialist, a medico, do webinars for us, and just listening to the things that they're saying about, the size of your arch and the importance of breathing through your nose and how that impacts on growth and intelligence and behavior and all that sort of stuff. Like, it's just so good finally that we're in this environment where we're spreading our wings holistically, which is
not being
obviously
to
what
work
you guys are
within
doing.
Other professions as well, whether it be chiro, osteo, physio, speech, optometry, they're all linked. And I think the moment we can do that and be comfortable to do that and create a good referral base around that, patients definitely benefit.
I think it's been, dentists have been looked at as, this optional thing in the past. So people don't come for regular checkups a lot of the time. It's only when they're in pain that they come to us. And I think it's more about advocating for us too, like putting the mouth back into the rest of the body. There's been like huge amounts of research done recently on like the microbiome of health and being linked to the gut, and it's really the gateway to everything, isn't it? And all of these autoimmune diseases that are emerging have been linked back to that gut microbiome. So it's a pretty exciting time to be in dentistry, I think.
We've just got one more question for you, because we know we're taking you from patients this morning and we really appreciate your time, but we don't want to keep you too long. So just to finish up, we've got one question, and that is, what advice would you give to a dental practice that currently isn't employing OHTs or hygienists or dental therapists? What would you advise them, or what would you say to them?
I think there's a misconception that oral health therapists will make life harder, take away work, whereas really quite the opposite. I think oral health therapists are an amazing addition to any practice, but it comes with teamwork. And you've got to set expectations, set goals, set boundaries, understand what they bring to the table, and then the relationship will flourish. Patients will be so much better looked after. And for the dentists, what they enjoy doing, they'll be able to enjoy doing more. And for the oral health therapist, if a principal dentist is willing to look out for you, look after you, you'll enjoy it more. So I think I would just say to any dentist looking at it, definitely do it. But just have some research. Speak to us. We don't mind.
Yeah.
It's something that we highly encourage. And we'll hopefully be looking at employing another one soon. So it's something that we're definitely on board with. And I think that there's ratios, there's this, there's that. But I think you get a good oral health therapist and a good practice, they will be performing very, very well for any principal dentist.
And I think Yeah, just making sure that
Lovely.
they know that they're able to approach you, like keep that open communication and that teamwork going. And yeah, I don't know what we'd do without our hygienists and our oral health therapists now. They're an integral part of the team. So
Lovely. Wonderful. So, Dr. Barrett and Dr. Barrett, thank you for joining us on Collective Dental Education Podcast today. We love talking to you. We love your work and keep it up. And we look forward to seeing you and speaking to you again once you come back from
thank
America.
you.
So,
Thank
all
you.
the
Thank you for your
best
time.
and thank you.